New numbers from the Minnesota Department of Health show the measles outbreak in the state is growing.
All of the cases are in Ramsey, Crow Wing, and Hennepin counties. There are now 44 people sick in Minnesota, and that's up from just 41 yesterday. All but 2 of those cases involve patients who have not been vaccinated. Health officials are now offering some new guidelines for the measles vaccination. Rachel Slavik is following this for us today. And Rachel, I know that health officials haven't seen an outbreak this big in years.
Right, Frank. In the last 20 years, MDH reports 56 cases total. That's just 12 more than the 44 they've seen in the last month. And health officials say the spread of this virus is made easier by those who go unvaccinated. New measles cases in Minnesota are quickly becoming a daily occurrence.
We're going to be seeing this for a while.
And at University of Minnesota's Masonic Children's Hospital, preventing the outbreak spread is a priority.
There's a lot of interest in measles right now, and so we're fielding a lot of questions from concerned families.
Dr. Shane McAllister, an assistant professor in the Division of Pediatric Infectious Disease, understands the concern.
We have a large population of potentially infectable children who are not vaccinated, and we have a disease agent that is extremely contagious.
This week, the state health department accelerated its measles vaccination guidelines for 3 counties. Normally, the measles, mumps, rubella shot happens at age 1 and again between ages 4 and 6. The new guidelines call for kids in Ramsey, Hennepin, and Crow Wing counties get that second vaccination just 28 days after the first dose.
And that provides additional protection for children that may not have responded to the first dose.
Unvaccinated children are most at risk during the measles outbreak, but certain adults could also become infected. Measles vaccination guidelines changed from a single dose to a double dose in 1989.
And so adults who were born prior to the late 80s should consider speaking with their physician about getting a second dose of the MMR.
Now, it is important to note that these guidelines aren't calling for an additional dose of the measles vaccine. It's just an earlier second dose. And also, we checked with insurance experts who said the vaccine should be covered as it is preventative care.
I have a feeling we'll be covering this story for a while. All right, thanks, Rachel.